Hi, good afternoon to everyone in the Pacific time zone, and later afternoon to or earlier morning to anyone in any other location joining us today.
Um, I think we'll go ahead and get started if folks are ready. Um, Thanks again for joining us for this webinar on improving health outcomes for intersex, trans, and non-binary communities from awareness to action. We're excited to be presenting this today. Of course, it'll be a high-level overview, but hopefully it'll inspire some curiosity and some ideas about where to learn more. Um, my name is Aaron Rook. I use he, him, or they, them pronouns, which just means that either option is fine by me. I am a transgender and non-binary PhD student here at the UNLV School of Public Health. My research focus is on trans cognitive and mental health, in particular the social and structural factors that shape those outcomes. Prior to returning for graduate school, I spent many years working as a journalist, including in LGBTQ media, doing equity-related trainings for healthcare providers and others, and doing kind of public health, applied public health work related to trans health equity in Oregon. So it's something I've definitely been engaged in and interested in for a while. And so I'm excited to have the opportunity to share this here, and also particularly to be working with Arcade to be able to incorporate more information about intersex folks, because it's important and it makes a lot of sense to talk about together. So I'll go ahead and pass it on to Arcade to introduce herself.
Sorry, I was I was muted. Hello, my name is Arcade Denali. I am a recent graduate of UNLV. I just got my Bachelor of Science in Public Health. I am intersex and transgender. My pronouns are she, her. I consider myself both trans feminine and trans masculine. I am particularly passionate about intersex and transgender healthcare. That is my niche in public health, because I found out about the word intersex during my time at UNLV and realized there is a word to describe my experience that I have had this whole time, and I did not know about it. So I want to try and champion advocacy efforts and research efforts in the future, to help provide the resources that I wish I had and that I didn't see in my community.
1 second. I think I lost did the slides leave the screen?
Yeah, you're
There we
not
go.
sharing your screen correctly.
Gotcha. My apologies there. Get that back up.
Please bear with us. As you're probably familiar with Zoom meetings, there can be little mishaps here and there, but
Great.
we'll be ready to present to you very shortly.
There we go. Yeah, for some reason my controls disappeared on me, so there we go. It's showing up as it should now. Arcade. Awesome. Perfect.
Right. Do let
So
us know for anyone in the chat if everyone's not able to see something.
awesome. So just real quick overview of what we're hoping to cover today. It's a lot, but hopefully we'll be able to touch on all of these pieces. Wanted to cover some just key concepts, terminology, and theories and things of that nature. Talk a little bit about the lived experience of intersex, trans, and non-binary people, kind of where those pieces overlap and diverge, some of the health needs, disparities, and related policies that influence health outcomes, and then talk a little bit about the idea of kind of communication as an intervention, right? We know we're all coming from different contexts, and none of us has the ability to wave a magic wand and make everything better overnight, right? But there are ways that we can, through our communications, have a positive impact. And then we'll move into our expert panel, which includes healthcare provider Dr. Archie Grimley, our UNLV-based researcher Dr. Jace Flat, as well as Interact advocate Apollo Roberts. So hopefully we'll be able to move through that relatively quickly and leave a little extra time for audience Q&A. But as Gabriella said, feel free to share questions along the way. And if they're clarifying ones, we'll try to address them promptly, or we can kind of gather them for the end. All right, so we'll want to start off with some basic concepts that will be helpful to understand as we move forward.
So first, I just want to give you guys an overview of terminology. You do not have to understand all of these off the bat. But they are building blocks, and we'll get into these concepts more further in the presentation. Just some important ones to touch on are transgender, non-binary, and intersex. Transgender describes a person whose sex assigned at birth or understood by society does not align with how they see themselves. Non-binary is a person whose gender identity does not fit the binary of strictly man or woman. Some non-binary people also do identify as transgender. And intersex describes a person whose sex characteristics do not fit the typically expected model of male or female sex. This is different from non-binary because non-binary generally is more about a person's gender identity and presentation, whereas intersex is about their sex characteristics. Finally, just cisgender is a person who is not transgender, and perisex is a person who is not intersex. So we can go ahead and continue to expand upon these a little bit. So sex and gender are two different concepts, and that's important to talk about in healthcare. Sex is informed by the way that we categorize physical traits in science and medicine, whereas gender is informed by the way that we think about our own identity. In medical and research contexts, you may see a person's sex broken down into different aspects, such as their chromosomal sex, their gonadal sex, their phenotypic sex or hormonal sex. For many people, all these different aspects of their sex line up. For example, a perisex cisgender man, that's a man who is not transgender and is not intersex. His chromosomal sex would be XY. His gonadal sex, referring to what type of gonads he has, would be testicles. His hormonal sex would be one where androgens are dominant and produce the typical changes expected of a male during puberty. So then we can go on and continue into understanding sex. When considering healthcare, it is important sometimes to know both someone's sex characteristics and their gender. Just one or the other isn't enough to provide comprehensive care because, as I said, with those different ways we categorize someone's sex traits, those don't all line up for every person. It also comes in like legal aspects, like someone might have one sex listed on their driver's license, which isn't represented in the traits of their body or their gender identity. And then I want to pass this one off to Erin next as well, who's going to elaborate a little bit on the understanding of gender.
So gender similarly is multifaceted, right? So broadly, gender tends to refer to the social roles, labels, expectations we have of folks based on the sex that they were assigned at birth. So kind of what we expect, when someone says it's a boy, what you're expecting that person to grow up to be like. Gender identity, though, is that kind of internal sense of yourself as it relates to that assignment of sex and your social role. And while this can often develop really early in life, it is like, even like toddler age, right? Very young age. Not everyone has the language or self-awareness to identify that at a young age, which is why we see people, coming out and transitioning at all ages and stages of life, right? So anywhere from toddlers to seniors, right? There's not like a rule that has to happen at a particular time. Gender expression, though, is really how that is the part that we see, right? We can't see or know a person's gender identity just by looking at them. And gender expression sometimes can be a clue, but it may not necessarily line up in the ways we expect either. But essentially, that's really how people are communicating, or we might say sometimes performing their gender to others. So, for example, you might think of, a cisgender heterosexual woman who lives in Pahrump on a farm and wears, very Carhartts and work boots and has short hair and, doesn't wear a lot of makeup because that's just practical for their lifestyle. And in some contexts, we might think of that as a masculine presentation, but that doesn't necessarily reflect anything about that person's gender identity. It might just be what's convenient, right? Whereas some folks might put a lot of effort into ensuring that the way they express their gender aligns with how they see themselves, right? Um, one thing I want to note too is that, when we talk about, what all these things quote unquote mean, I think it's important to understand that our awareness and ability to articulate these things is constantly evolving, right? We're coming up with and discovering new ways to refer to things, new ways to frame things. And so I just think it's important to say I don't think there's one right way to frame or understand what these things mean, right? So I just wanted to share a couple of different models that you will often see folks engaging. One is the idea of a spectrum, and sometimes people frame that spectrum as having masculinity on one end and femininity on the other. But I think increasingly we're seeing the recognition that folks might have these qualities simultaneously, right? They're not mutually exclusive, right? Which is why you see the spectrum image here just goes in one direction, right? So you can be masculine and feminine and any other qualities at the same time. But another way of looking at it that I kind of like is a bit less specified, I suppose, but thinking of in terms of like a galaxy and kind of the context of the universe, right, where every individual person, we recognize is unique, right, just like any star, snowflakes, if you will, right, are unique. But at the same time, we do see kind of clustering, right? And so if you think about this image of, I believe, the Milky Way, hopefully, we see stars clustering together. And so maybe this is, okay, maybe that's men, and that cluster over there is women, and this cluster over in another place is another identity, right? Recognizing that we do see folks kind of having similarities in the way they might experience and express their gender, but at the end of the day, everyone is, has unique qualities, right? It's not, there's not just two options. It's probably as many as there are people. So at the end of the day, really the important takeaway is that we trust people when they tell us what they know about themselves in terms of gender, because gender really is self-defined and self-determined. So that also means that people, trans and non-binary folks in particular, are experts in their own experiences and needs. I think sometimes we can see this framed as if it were some sort of a bias, right? That people have like a vested interest perhaps, but really ultimately it's a benefit. And if we think about for example, things like community-based participatory research methods, right, is a similar idea of recognizing that impacted communities have a unique understanding of their experience that is really important that we honor and respect, right? And so just, kind of that applies on a person level as well as a community level in this case. And I will say, just kind of the little nerdy side note, that this kind of recognition of that value of the lived experience is sometimes referred to as epistemic peerhood, which is really just recognizing that, much like a medical doctor might have a level of expertise that's relevant in a context, the person who has that experience in life also has a unique and important perspective to bring to that as well.
So, two other big concepts that are really important, not only to transgender, intersex, and non-binary healthcare, but also for everyone, are the concepts of bodily autonomy and informed consent. Now, bodily autonomy is the ability to make your own decisions about what happens to your body and to be informed in order to accept or decline on your own terms. Informed consent, on the other hand, is having the full knowledge of risks and benefits and conditions of an agreement in order to make an informed decision. So, an example of this could be a patient sitting down with their healthcare provider, inquiring about a certain form of birth control, and their provider would sit down with them and explain all of the potential risks and benefits, likelihood of complications, or what you could do if complications were to occur, and also any potential effects that could happen for that individual person based on the unique traits of their body. And the other key thing is that these two concepts intersect. Having bodily autonomy happens by having informed consent to like medical treatments that you might decide to have. And it's also worth noting that informed consent and bodily autonomy are not concepts limited to medicine. Informed consent also shows up in research, for example. So I want to get on next talking about our lived experiences. We have a couple different slides within this category. So first off is just some basic figures talking about population prevalence. In the United States, we know that about 4% of Americans 13 and older are transgender, whereas we at least have a figure worldwide for there are about 1.7% of people are intersex worldwide. To put these numbers into perspective, if you're in a room of 1,000 people, 17 of them will be intersex, 40 of them would be transgender. And if you know 100 people, statistically, probably at least 4 of them are transgender and at least one of them is intersex. And now you know at least one intersex person here. So the word intersex, it's kind of a new word to some people. Intersex is a broad term describing people with variations in their sex characteristics, like their chromosomes, their gonads, external or internal genital structures, their hormone production, secondary sex characteristics, all of these traits which do not fit into the typical developmental models of either male or female. Some examples of variations in sex characteristics that we're talking about here include like higher levels of androgens in a person with XX chromosomes, which for them could cause the development of heavy body hair. Or you could see ovaries present in a person with XY chromosomes. These variations may be noticed at birth, or they may develop naturally during puberty. They may have associated traits or other symptoms, and they may also have specific names as we categorize them in medicine. Some of these variations are named, like an example is Klinefelter syndrome, which is where a person has XXY chromosomes. Another example is congenital adrenal hyperplasia. Um, though it is rare, some variations do come with some associated health effects, and some people voluntarily choose treatment of these traits that come with their variation. But intersex variations do not inherently pose threats to a person's health. They're a natural part of human variation. However, intersex people do sometimes need specialized healthcare because a lot of our healthcare infrastructure, especially, is not designed to support intersex people. It was not designed with them in mind. Often it doesn't account for intersex traits as a natural variation, and it's common for them to be treated as disorders which require correction through medical intervention in order to fit a binary model. Next, I think we have talking about gender identity for you, Aaron.
Yeah, speaking of things that being pathologized and trying to fit things in boxes, right? We see similar things happen with gender identity. But it's part of why we wanted to take a minute to talk a little bit about what transition can look like for folks and what it may or may not look like. Because I think we have a tendency to have kind of a singular narrative about transition, right? This idea of, kind of like you almost imagine in a sci-fi way, someone kind of goes into it like a, I don't know, MRI tube or something like that. One way, comes out the other side, fully transformed, a totally different person, right? But it's not, really that kind of a situation, right? There's a lot of different aspects that can be involved in transition for folks. Every person's going to choose maybe a different variety of those that feel important to them. But I think broadly, for most people, social transition is kind of the first thing that folks explore. And for some people that is kind of the extent of what transition looks like. Certainly for minors, for children, that is often what transition means, and we're kind of coming out as trans or non-binary is often around things like exploring maybe using a different name or pronouns, maybe changing hair or clothes or other pieces to better reflect and affirm how people see themselves. Obviously not a medical piece at all there, but something that certainly can come up in healthcare contexts, right? When we think about things like the forms that are available to people or how they're referred to in records or just how they're treated by people that they interact with. But beyond social transition, which again, everyone has a different path that includes different pieces of this. So for example, you may have noticed that my name is Aaron and it's spelled Erin, which I think is still generally considered a feminine spelling, although maybe that's changing. I have not changed my name for a variety of reasons that I'm not going to bore you with, but that's something too that I think people often assume, if you are trans or non-binary, you are definitely, you're going to change your name, or that, your pronouns are going to be something very particular, or that you, want to wear a certain kind of clothing, or that you, I think particularly right, that this idea that non-binary people are exactly in the middle of some kind of a gender spectrum and want to to be perceived as ambiguous or very much in the middle, which is not necessarily the case, right? Just again to use myself as an example as someone who is transgender but also identifies as non-binary, like I recognize that I am a fairly binary presenting person, right? I generally broadly perceived as just a guy, right? I get boss and captain and all the other fun things that we call men in our society. But my how I actually see myself is, a little more nuanced than that, right? But I recognize that that's not necessarily I'm not trying to wear skirts or kilts or I'm good, thanks. So, right, it's different for everybody. But beyond the social piece, one aspect can be legal. That's where there's like a lot, can often be a real patchwork for folks. That most trans people don't have all of their documents having the same information. And for many folks, they don't have any of their documents that match their gender identity. And that's because if you have ever had to change your name, maybe you got married or something like that, there's a lot of different places you have to go to change those pieces of information and a lot of bureaucracy, often fees. And so that's why, as we talked about, aside from the general diversity of sex and gender, someone might have different information in different places. And when you say, what is your sex or what is your gender, that might have a different meaning in a different context, right? In terms of the kind of the medical piece, again, so much variation and diversity of experiences people might have. Some people don't pursue any kind of medical transition, whether it's because they just aren't interested in that, or maybe they have other health concerns that are not compatible with that. And it can be any of these hosts of things, right? Hair removal can be gender affirming care. Different kind of shaping procedures, right? Whether they're surgical or fillers or things to change people's silhouettes. I think what we hear about most often, right, is hormones, as well as kind of like top and bottom surgeries. But again, there are so many different paths that people might take, and we can't really know unless we've talked to someone what that path looked like for them. Um, and then in terms of for youth, often that the most often looks like puberty blockers, right? Which kind of put a pause on things and allow you to prevent some of the unwanted effects of some of the hormones. But ultimately, you know, it can look like any of these things. And it's important to know too that people might change their mind about what they want to pursue, or some folks might take hormones just long enough to get certain, permanent effects and then be like, I'm good. I don't need to, continue taking them. And so there's a lot of different ways that can look. But it's also important to know that there can be a lot of barriers for folks, right? And we're seeing more variety of barriers than we've seen in the past, but even just kind of the basic logistical piece of generally most places still requiring letters from a therapist in order to often to change an ID or to access medical care. And those letters essentially are, it's I'm not gonna lie, it feels a little offensive sometimes that you have to provide these things, right? But essentially, a therapist saying that you are in fact a transgender person and not in some way delusional or whatnot, and those things have to be maintained and current and recent and whatnot. So that can be a barrier for people if they don't have the resources to access that kind of support. But regardless, it's basically the moral of the story is there are a lot of different ways that transition can look. And for some people, that might be described as a real process that has a clear starting and end point. For others, it's a lifelong kind of evolving experience. But people are valid regardless, right? And there's not really utility in having people have to prove that they are quote unquote trans enough or that they've checked certain boxes because everyone has slightly different needs, right? And that applies to we're not going to get in depth into this piece, but people may pause or stop or reverse their transition for a wide range of reasons. Usually those have to do with things either health related pieces or experiences of stigma and discrimination. But regardless, that doesn't change the fact that folks need support in those pieces. And one thing, we wanted to talk about briefly too, I don't know if it's surprising to anyone to think that, 4% or more of the population is trans. Because I will say, I think most of those data points are probably underestimates for a variety of reasons related to, the challenges in getting data from trans populations. But, there's a real tension around things like visibility and safety. I think over the past 10 years or so, we've seen a real dramatic increase in the kind of broad media visibility of transgender people, but that hasn't always come with safety. And so wanted to just share just a brief quote from a piece written by a transgender attorney with the ACLU who has been involved in arguing some of these trans-related cases at the Supreme Court. And this is actually 2 years old, but it feels very, very much still relevant. But Chase Strangio says that visibility is a gift when you grow up thinking your existence is impossible, but being invisible can also bring protection. He says, I might not have seen myself on screen in my childhood, but neither did I have to deal with dozens upon dozens of bills filed each year, questioning my right to use the restroom that matches my gender, have access to healthcare, learn about the history of trans people in school, or worry about which sports teams I was allowed to play on. He continues, the representation of transness on screen is crucial for building empathy. Trans visibility has also contributed to a false sense that the community possesses a degree of stability and power that in reality continues to elude us. Um, and I just felt like that it really kind of captures, I think, a lot of the tension that we see, um, and particularly in this moment, right, where um, people are feeling less and less safe being visible about who they are, um, and that poses a lot of challenges, right? Makes it hard for people to connect to one another because while it might, I know the way we talk culturally about things like gaydar, right? You might assume that all trans people inherently know when they are in the presence of another trans person, but it actually doesn't. There's not like a little, you don't get a little ping on your phone or anything like that. So we also have to have that safety in order to find one another, right? And so uh, there again, right, it could be that tension. And we also know that in order for people to learn about the experiences of trans communities, like someone has to be visible and someone has to say something. So I think it just kind of speaks to the importance of creating spaces and contexts in which it is reasonably safe for people to do that, right? Because it definitely a lot hinges on that piece. So that said, I want to talk specifically about some of the healthcare access and outcome pieces. Um, I think some of this is maybe familiar, but some pieces maybe less so. Um, so compared to cisgender adults, trans and non-binary adults certainly have elevated rates of a variety of health concerns. I think we're most familiar with some of the mental health impacts, things like suicidal ideation and attempts, right, where there's really dramatic differences in the rates. But we also see differences in physical health and disability, right? Trans and non-binary adults are more likely to report disability, chronic illness, including things like cardiovascular disease and asthma, which might not be as intuitive to folks. And then on a state level, this data is a little bit older now, but among transgender people who participated in the US trans survey in 2015, a significant portion, almost half, said that they didn't feel like they could safely seek help from law enforcement. Um, Almost 44% were living in poverty. 43% said they avoided using a public restroom because of fear of harassment, which has not just mental health impacts, right, but physical health impacts. And a third said they delayed necessary medical care because they were concerned about mistreatment, right? So we know that there are not only, direct disparities in mental and physical health, but also in a lot of these social drivers of later health outcomes.
And I'd also like to talk about intersex health disparities. Unfortunately, we're lacking quite as much thorough data, but the some of the important facts to focus on are most healthcare professionals do not have or they have not been provided training to know how to care for intersex patients. According to the Health and Human Services report that was published in January of 2025, intersex people often encounter unnecessary health risks contributed to by the fact that our healthcare system has not been designed with them in mind. Because of the history of mistrust and medicalization that intersex people have experienced, many intersex people avoid medical care, even in the case of emergency services or routine health screenings. Some of these facts are elaborated on in some of these studies that were compiled in the Health and Human Services report. For example, 65.4% of intersex participants had delayed healthcare due to past negative experiences. We also see some of these mental health effects, such as reporting negative body image or social isolation, fear of rejection, and feelings of devaluation, as well as higher rates of these mental health effects like thoughts about suicide or suicide attempts compared to the general population. We can also move along into health needs. So when it comes to the needs of each of these individual groups, the core concepts are similar, but they differ in the ways that they show up for each person. It's not accurate to lump everyone together into the same group and assume that the care they need is the same across the board. Transgender, non-binary, and intersex people alike, we are all in need of more trained healthcare providers. But a provider being trained in transgender healthcare doesn't mean that they are trained in intersex healthcare, nor would a provider trained in intersex healthcare necessarily be qualified in non-binary healthcare. Intersex people currently do not have civil protections federally in the United States. They also don't have standards of care used universally by hospitals or medical organizations. And as I mentioned before, we don't have extensive population data. Trans people do have the WPATH standards of care, but transgender people are becoming more prominent in the public eye in subjects of debate, having legal protections rolled back or restrictions to gender affirming care put in place. And non-binary people not only face similar struggles as transgender people, but also face difficulties in accessing care that actually allows them to transition and present in a way that isn't this strict idea of binary. An important shared struggle I want to bring up is between some intersex and non-binary people. Not applicable for everyone, but it is something that happens, being mistaken for basically close enough to male or basically close enough to female when they don't see themselves that way. And thus they end up being treated as though their health needs are basically the same as a peri-sex cisgender man or woman. This is not an accurate picture of the person's full health, and this will block them off from decisions that they can make about their own body. Since intersex, transgender, and non-binary are not mutually exclusive categories, there are also some needs that come across for intersex people who are also transgender or non-binary. For example, a perisex trans woman, as in not intersex, may not need screening for ovarian cancer, but an intersex trans woman might if she has ovaries. Another key difference that I want to touch on is the difference between non-consensual medical interventions performed on intersex people and gender-affirming care for transgender and non-binary people. The main difference is the consent given for these procedures. Gender affirming care for transgender and non-binary people is something patients seek out voluntarily, although we are seeing more restrictions to gender affirming care in recent legislation in the United States. The thing is that trained providers inform patients of the benefits and risks, and non-consensual medical interventions for intersex people refers to those which are not medically necessary and which are not desired, and the risks of which are not properly communicated to the person. The potential for harm caused by these interventions comes from, in part, the fact that an informed consent was not obtained. Um, an intersex person may be pressured to undergo procedures, or the family of an intersex child may be pressured to choose such procedures for their child. Ultimately, the thing to remember is that it is not about the access to or restriction of any one treatment or surgery or medical intervention across the board for every person. It is about like maintaining the bodily autonomy for everyone. So we should be ensuring that intersex, trans, and non-binary people have bodily autonomy, are given access to treatments to choose from, and are provided the knowledge to make fully informed decisions about their medical care.
Awesome.
So next, I think, Aaron, you have a lot more to touch on about healthcare policies in the United
Yeah. I
States.
want to talk about some of the pieces that influence this, right? Because recognize, I don't imagine that everyone in the space today is a healthcare provider, and I think it's important too to understand that how broadly some of these pieces touch, right? And that it's not just a health provision of healthcare kind of context. So kind of broadly, and when we think about the policy environment, as it pertains to gender affirming care and other kind of related rights for trans non-binary folks, most people in the United States live in one of two policy environments, right? There's obviously diversity across states about how things they navigate, what kind of policies they pass in a variety of ways, but it tends to cluster on one of two sides, right? So the movement advance, this maps from the Movement Advancement Project. Definitely worth checking out their site. They have a lot of interactive tools you can use, but essentially they create an index where they score states based on either positive, supportive policies, an absence of policies, or negative or harmful policies, right, in a variety of areas. So those include healthcare, but also things like identity document access, non-discrimination policies, things of that nature. And so you can kind of see it's fairly intuitive, right? That the green is generally the more positive, and the red is the more negative. But really, about 40% of trans folks 13 and older live in a high, in a high gender identity policy scoring state or in a negative policy scoring state. It's kind of not a lot in the middle, right? And we can see that strong demarcation. And that has real impacts, right? So as a result, a fairly significant number of trans folks, 30 to 40%, right, are living in a state that restricts access to restrooms at school, that bans best practice care for minors. And I say best practice, right, because there are standards of care, right? So banning care that aligns with those best practices and standards, or that restricts access to youth sports participation. Um, Also speaking to that autonomy piece, right? A majority of states either enable discrimination by defining gender as binary sex assigned at birth, which we now know, right? Those are different concepts. There's a lot more diversity in that. Or they have laws requiring schools to notify parents if there's a change to a student's gender identity. So again, it's not bodily autonomy per se, but it's really kind of that piece about privacy about your own health information, and the self-determination to choose when and where that's disclosed, right? So folks are increasingly in an environment where they don't have that kind of autonomy. And then we're actually getting to a place where we're seeing increasingly criminalization of aspects of trans people's experiences. So in 6 states and 1 territory, it's currently a felony to provide best practice care to trans folks. And in 4 states, it's currently a crime for transgender people to use a gender-aligned restroom. With the potential for that to escalate to a felony. So we think about, right, there's a lot of restrictions. That's the moral of that story, right? And so those are obviously kind of direct impacts, but it's also important to know that even if people are not directly affected by some of these policy restrictions, awareness that they exist, that they're out there being considered can have impacts as well. So Dr. Farr actually at UNLV has done, and others have done research that shows that just being aware, for example, of bills related to sports participation are associated with increased risk of suicidal ideation, right? So that rhetoric piece, and that's why we're really thinking about kind of conversation and communication as a way to engage and advance equity outside of like a direct care or a direct applied context, is because that rhetorical piece really has an impact on folks' mental health, right? So kind of cues up to kind of how we're thinking about framing this piece, right? We know that like these topics, it can be a lot to just to understand the basics of what people's experiences are, and then to put on top of that, a really rapidly changing policy environment that might feel outside of our individual control. I think, communication is an area where we all can have some impact, right? We're all talking to people in some way, in some form about these things, and they're increasingly coming up in conversation. And so, I was really thinking about, and maybe in part because of my background as a journalist, but just of the power of stories and of storytelling and the way the narratives we create about people, right? And so just a couple quick, some data points that are helpful to know in relation to this. Depending on which study you look at, it's between 30 and 40% usually of the US adults report knowing a trans or non-binary person, which is more than it used to be, absolutely, right? I didn't know a trans person until I went to college, to undergrad. And so that's better, but it's still not everybody by a long shot. And people largely still report learning about transgender people through the media, right? And increasingly that includes social media, right? It includes what we see and hear out in the world. And there have been studies, usually in kind of a political context, right? But that show that knowing the association between knowing transgender people and being sympathetic to the concerns or the needs of those populations, right? Which feels fairly intuitive, but it's interesting to know that there's data supporting that, knowing people from a marginalized or stigmatized community impacts the way we feel about them, treat them, and the decisions that we make related to their lives. But I think the big piece that I hope folks can take away is that you don't have to be an expert in trans health or any of these pieces to be able to help change the overall narrative, right? Because ultimately, at the end of the day, we want people to be treated with respect and dignity, and there's knowledge is certainly a piece of that, right? But the way we talk about people matters too. And so I think, yeah, we have more opportunities to do that than we might think sometimes. But I think, Arcade, you wanted to share maybe some
Yes.
specific approaches that folks can do.
Yeah. So, obviously, especially if some of this information is new to you, it's probably very overwhelming to think, what can I possibly do with this? What are the steps to do next? So a couple suggestions that I have are, first off, get involved with your local community. You don't have to be a part of it yourself as long as you're approaching it with genuine curiosity and good intentions. Look for your intersex, your transgender, your non-binary communities. Look for like events or seminars like this one. Look for training, see if they're local or national. Get a feel for what your community has and what it's missing. And I always encourage people, ask questions, learn with curiosity. That is one of the best things that you can possibly do. You do not have to be an expert. And also providing the space for gatherings and community. One thing we lack is just not having a place to get together and bring people together to talk about these things. Another thing is including the letters in your LGBTQIA acronym mindfully. If you are part of an organization, like a workplace, like work group organization, and you say, we are like an LGBTQIA work group, make sure that you're actively including transgender and intersex and non-binary people. If you're going to say, hey, we provide these services, it happens sometimes that, like in studies, talking about LGBTQIA health, intersex people will get included in title, but won't actually have any specific data collected for them. Same with like, healthcare organizations. You might be looking for resources as an intersex person, or say as a non-binary person or a trans person, and see this organization says like, we have trans healthcare and intersex healthcare, but then you go look for the resources and they actually don't. Um, Another very important thing to do and just to get yourself to start thinking about is considering intersectionality. And intersectionality is about how different identities overlap and may cause someone to have a different experience. Like what I'm talking about here is a Black trans person they may experience more or different barriers to care than a white trans person would because of that intersectionality of identity. And a non-binary intersex person may need different care than a non-binary perisex person. Um, Finally, of course, I want to say education. Education, that is one of the biggest things that we need right now. Um, there are different ways that like you can get that educational ball rolling. One example from a resource that I have included later is Lambda Legal's Healthcare Inclusivity Guide. They actually recommend providing things like pamphlets or infographics or fact sheets in common areas like lobbies or waiting rooms. If you have helpful resources yourself, share them with your friends, your family, your coworkers, whoever it's appropriate to share those with. And we also need to start paying more attention to including intersex, transgender, and non-binary people in things like sex education. And like, this is just a list of ideas to get you started. Again, I want to emphasize the best thing you can do is learn and ask questions. The more cognizant we are of health disparities among intersex and transgender and non-binary people, the better equipped we are to start alleviating these disparities. Even the efforts to inclusion that you might think of as small or insignificant could make all the difference for someone in your community. It could make all the difference for a whole community. Um, as long as you have that curiosity and respect, that is the best place to start. Not every person in the world will be able to answer every question that you have, but some people in your community might be very glad that you asked. Some of the most rewarding, like instances of advocacy that warm my heart that have happened for me is someone who feels like they're super uneducated and they don't know anything coming to me and saying like, hey, can I ask you about this? And it opens up a whole wonderful conversation. Um, so I wanna leave that off there with these ideas just to get you thinking, get you started. Do not be afraid. Any honest efforts are so appreciated.
I yeah, I wanted to say ditto that. And one little thing that made me think of I wanted to add is um, also thinking about the little steps in terms of educating others, right? Um, you don't have to, again, to be an expert, and sometimes even asking a question can be a form of education, right? To raise awareness of like, oh, you sent out that survey. I'm curious if how you're asking people, how you're making sure that we're including trans and intersex people in the way we're asking that, or the way we've created that form. You don't have to have the answers necessarily all the time, just to kind of raise awareness that something might be worth considering. And then the other piece I think is, realizing that education doesn't always have to look like, here's an article, here's a petition, here's a, I don't know, highly charged something or other. It can often just be bringing things into conversation in a way that recognizes that trans and intersex and non-binary people are part of our lives and communities. I think one thing that I noticed recently that I struck me as potentially impactful that I think we don't think about is, like my own parents just, she had shared something about, right, recently getting my MPH or what have you, and they could have just stopped there, right? But added a comment, about what I was actually focused on in terms of my research, right? And that opens a door for them to be able to have conversations with people in their life that I would never be able to have because I don't know those people. And even if I did, they may not care what I have to say about things. But people are curious, right? I recently learned that when they connect with people from their childhood or wherever, back in the day, they get people ask them questions, right? Like they've heard through the grapevine, right? It's a novel enough thing that they're curious, but there are people that are curious in, like Arcade was saying, these ways that they're respectful and they're sincere. But if we never raise things as a topic of conversation, if trans and intersex and non-binary people don't even exist in the stories we tell about our lives, then it really cuts off opportunities for conversation. So I think kind of just this reminder that, yeah, those little pieces that we all have different spheres of influence, right? And sometimes just bringing up your own personal connections and interactions with the community can be more powerful, I think, than we might always realize. Uh, but with that, we want to take a quick pause and pivot to um, the panel, and we'll again
Yeah.
ask some kind of,
Speaking of asking
yeah,
questions,
right. We'll ask a few, and then we'll let you ask a few. But I want to do some quick introductions first. I know you probably saw them floating by on the screen. So obviously, not everything you could know. I mean, we could have like multiple slides about each of these people, and we still have things to say probably. So obviously, all of you, please feel free to add anything you want to add about your background. But I'm just going to try and touch on a couple of key points so folks have kind of a sense of context. So we wanted to try and kind of span a broad array of backgrounds, but we have Dr. Archie Grimley, who is a healthcare provider. Yes, also member of a queer non-binary person, right? Member of this community, but also working with the community in a variety of different contexts. And I'll let them talk about that if they would like to, but both through CAN Community Health, which is some folks may be familiar, formerly Huntridge Family Clinic, but also doing work through Planned Parenthood and a pro bono private practice. We're also joined by Apollo Robert, who is intersex and transmasculine, works in advocacy with intersex youth at Interact, and is also working on his dual master's degrees in macro social work, which I gather is like that systems level piece, and public health. So that's cool. And then Dr. Jace Flatt, who folks may know is a professor in school public health at UNLV, focusing on LGBTQ aging and brain health, et cetera. But also really, and I don't have this in the write-up, right, but has been, I think, a strong ally and advocate for increased inclusion of trans, non-binary, as well as intersex populations in health research, right? And doing that in a community engaged way. So I think I'm really looking forward to hearing what our panelists have to say about some of these questions, and hope you all are thinking on your own questions for when we let you all loose in that sense. But I think we'll stop the screen share so we can see people's faces. Um,
I just wanted to add that some of the information that was in this presentation was from studies which have Dr. G.'s Flat as an author on them.
yeah, so
Thank you.
we're in the presence of people that know what they're talking about, right? And in multiple ways, right? Because I do want to kind of go back to that idea of like having experience as a member of a community is its own expertise, right? But then we have the benefit of folks having like additional professional expertise on top of that, which is cool. Um, so let me just pull up questions here real quick, and we'll get rolling. And of course, you all are welcome to kind of chime in however you like. I'm not necessarily going to call on folks unless it gets real quiet for some reason. But I thought, first it would just be great to hear, you know, obviously we've shared kind of a highlight, overview that such that we could, but what would you say from your perspective you wish that public health professionals knew about the communities or populations that you work with in this context?
I could go. Hi. I'm Archie or Dr. Grimley. Thanks for the introduction, and I'm honored to be here alongside these two lovely people. Um, I
Thank
think
you all so much.
um I think that the very, very first thing that comes to mind is that there is frequently an assumption, and this happens a lot in medical spaces in general, and it even has a really cute name. It's called the trans broken arm syndrome, where everything is blamed on hormones. If a person is on hormones, they're like, your cough, your every, like, whatever you go to the hospital for, whatever you go to the doctor for, whatever you're experiencing, whether it's pelvic pain, whether it's like any other issue, is very frequently just said like, oh, it's because of the hormone therapy that this person is on. And it is almost never because of the hormone therapy that the person is on that they're experiencing the symptoms that they're experiencing. And so I think that like that putting that out there into the world, especially as public health professionals, kind of knowing that and feeling emboldened to push back on providers who are not listening to patients, because I think that frequently that is a job that falls on public health professionals. Like, and a really, really great way that public health professionals in particular can really serve our community is just like being the voice for people who are marginalized and can't really speak for themselves or wouldn't be listened to if they did speak for themselves. That's my first just like thought.
I'll go next. So I totally agree with what Dr. Grimley has shared. I think in my own work, uh, right, in public health, we're often trying to like generalize for a population. So thinking about transgender, non-binary, or intersex communities, and we use like data to do that. But I struggle with this because I think like this isn't really true. You meet one person, you've met one person. Their own experiences are very unique, and they often don't generalize to another member of the community, right? And how we all live, maybe where we are, people in our lives that have shaped our experiences or even our health. And so that's one of the things I think that we all need to be thinking about is like you've met one person, you've only met one person. Their experiences do not equal what another person's experiences might be. So you need to treat them like you're meeting them for the first time and fully go through like the pieces of asking about their needs. We often call it like personalized care or person-centered care. You can think about that of really just meeting the individual where they are, building trust, and making sure that you're addressing their needs specifically. So that's where I would kind of summarize.
I think it's my turn then. Hi, I'm Apollo Robert. I'm the youth program manager at Interact. I forgot to put that on my bio, so that's my job title. What do I wish public health professionals knew? I wish there was just more awareness of unique disparities that impact intersex people and also trans and non-binary people. Because, like, as a personal example, when forms in clinical settings ask for like specific like medical history on like menstrual health or like pregnancy history, uh, and they often have like it's like often a yes or no question, and then if it says no, it often only includes one follow-up like, oh, have you had a hysterectomy? But it's like, what if I wasn't born with some specific anatomy, but I have some specific anatomy that would still label me under this sort of like category they're trying to categorize me as someone who could menstruate. But then it's like that it's complicated and like hard to kind of get that across in a medical form. And then it's like, okay, now with this provider, I have to spend extra precious time talking about this like nuance about my body when I could be like spearheading like more in the direction of what this appointment is actually about. So that's something that I feel like public health professionals can be really good with of like advocating for like just more inclusive forms and like paperwork that like is not just helpful for only intersex people to have variations in their body, but like trans people and non-binary people and just people that are cisgender and perisex. Like people have surgeries that remove certain body parts for a variety of different reasons, and it makes medical information complicated. So there's something called organ or anatomy inventories, and I think those are like amazing. They can't be implemented everywhere, but like just because they're long, but they're just like one really cool thing to advocate for in certain settings that like would help a lot of people.
Yeah, I appreciate that. I feel like I'm hearing like a lot around the importance of, again, like the patient experiences, right? It's like it's almost like people from these populations know things about what would be helpful for them that others could potentially listen to and learn from, right? And so I appreciate that kind of common thread. And I think it's hard, especially in a medical care context, right? That idea where you've got like the doctor as ultimate expert kind of dynamic that can be a little tricky. And so I appreciated the this kind of idea that positioning of public health folks as sort of advocates on behalf of people within those populations, or as like almost like an intermediary with clinical folks and things like that. It makes, I think, a lot of sense, and also conveniently ties into the next question,
Yeah,
which
I'd
is
like to
that,
go
yeah,
ahead
go for
and
it,
read
yeah,
off the next one if I could.
sure.
Um, so what are some specific things that medical providers or public health workers and also the community do to better serve the trans and intersex and non-binary communities? If you want to go in the same order, we can do that again as well.
I can I mean, the first thing is to just make sure that you're using inclusive forms to ask about the identities of the community, right? If we don't, thinking from the public health perspective, if we actually don't know about the communities that we're including in research or in our public health programming work, then it limits really our understanding. So asking questions around sexual orientation, gender identity, and intersex traits, right? Really understanding the communities that we're serving. So that way, if we're going to expand reach or we want to evaluate how well our program is working, that we truly know the communities that we're engaging. So that would be one of the first things I think we should. Right. We often hear this, but like it's around Soji and asking about intersex community members. So
Can you repeat the question one more time? I want to make sure I understand.
Yeah, sure thing. The question was what specific things can medical providers, public health workers, and the community do to better serve the trans, intersex, and non-binary community?
I think for me, so the way that I practice medicine is really under an informed consent model, period. Harm reductionist, and I practice informed consent. And it's not my job to gatekeep meds, and it's not my, like, that's not why I'm here. And so I think that as a whole, within the health fields, shifting away from a paternalistic, like, model of care towards a model that's like based on informed consent and like patient autonomy and like the fact that humans are their own like they know the most about themselves. Like I don't know anything about anybody who comes to see me unless you tell me. So I think like remembering that and keeping that as a really important value in the way that you give care to people, I think can make a really big difference, not only in care for intersex and transgender people, but for every person that you interact with. Like, remember that this individual person, like, try to catch yourself making assumptions like, and when you do make an assumption, apologize, like, name it, be like, I'm so sorry that I assumed that. Like, it, we all make mistakes all the time. We all are built, like, are raised in this world that is filled with all kinds of stereotypes and things that are just ingrained in us from the beginning. And I think that, like, actively trying to combat that is so valuable and so important. And that, I think that's the best thing that we can do.
I was trying to think something that was different than my previous answer, but it might be more effective to just continue on with a different question.
Sure. All right.
Sometimes,
Should we go on to the next question?
sure. Not sure if you was one you wanted to particularly ask next, but I think a lot of what you're saying points to one question we had, which is, why is it important for intersex, trans, and non-binary voices to be centered in decisions that impact their health? And I'm also curious, both, if, to the extent folks are comfortable sharing, ways that intersects with your own experience, but also, what does that actually look like in practice, right? Because I think sometimes it's easy to say, yeah, we trust, we care about this community, or we're focused on this community, but what does it actually mean to put those folks in the center and to kind of let them drive the decisions?
I mean, it's a basic, seems like a basic human right to me that everybody's views and opinions and their experience should be a part of their care, right? That they should be able to have autonomy around guiding, their care needs and their experiences. Um, and I think what it is we need to stop forcing, hetero cis normative models onto everybody and making really, changing the way we do care that's really based on sort of the person and their experiences. I liked what Dr. Grimley talked about, like really this informed consent approach, something that really tailors it to the needs of the individual. And doesn't force them to fit into, are you part of this group or this group or this group, right? I think in the same sense as like we shouldn't just have an LGBTQIA plus focused healthcare model either, right? Right. There needs to be really something that's tailored to the needs of each person's experience, and figuring out ways that we do that without forcing, sort of these I would say archaic ways of medicine that in the past have been used. So
For people with my specific variation, they're often really, really subject to a lot of cis heteronormative biases of your body should or shouldn't look this way in order to be like normal, and that even if they're teenagers when they're first finding out, and being given a sort of informed consent about like their options, there's still this like societal pressure and bias that a lot of providers can accidentally engage in of like prescribing normality of like this will make you feel more normal when that might not be the case because this person, even if they undergo any sort of treatment or procedure, they could still feel different from their peers in a way that like, okay, I've gone through this, but now what? Like I still feel very different from everyone else I know. And then like slightly off of that, like in comparison to a lot of people with my specific variation, uh because I was diagnosed more young than my peers, I was able to get inclusive sex education for my variation from like the get-go when I first started puberty, and that led me to have a lot of like confidence and resilience and positivity towards my body and sense of self that a lot of intersex people with my variation or otherwise don't often get. And having such a patient-centered experience throughout all the following specialist appointments I had was just like it should be a given, but for me, it seems to kind of be very uncommon, unfortunately, for intersex people. And I always like to emphasize how just patient-centered bodily autonomy, respect, and informed consent just like they're a given, but they can do so much for people and making them feel seen and make them feel comfortable asking vulnerable, embarrassing questions about their body of like, how should I do this or how should I do that? What do I need for my specific bodily needs? Just having that ability to trust a provider is like life changing.
I think like for this question, I guess like my mind goes straight to like the macro scale. It's like on a wide level, we're banned from going to the bathroom. Like that's crazy. That's nuts. That's wild. That is absolutely bonkers. And everybody who's in this meeting probably knows that because you selected to be in this meeting. And so I think that it can like there's some bits of it that are just like should be obvious. Like if a law or a policy or a decision is going to impact somebody, then that person should be in the room for the discussions on making that policy and the decision. And so I think that that's a little bit intuitive, but I do think that that never happens for intersex, trans, and non-binary people almost ever. Um, an example that I have is that one of my employers, my primary employer, banned me from prescribing HRT for all my trans patients last April. And in response, I like created a private practice and I'm doing a pro bono outside of it. And it's this whole thing, but like I wasn't in the room. Like it's like it's crazy. I like they just blanket do this. They're not experts in the area. Like, so I think that a lot of time, money, and energy can be saved if you just include people in the conversations. It's economical, it's good for the people that are involved. And it'll like end up having better health outcomes for everybody, which is what we want. So I don't know. It's bleak out there, but if we could just squeeze our way into the rooms, that'd
I
be
I feel like seminars like this is one of those places to get that started and include all of us in the conversation.
yeah, totally.
Are we ready to move on to the next question? All right. So next, I would like to ask you all, why is the health of intersex, trans, and non-binary populations relevant outside of the provision of healthcare services or clinical research?
So I'll put it from like a research lens, right? In terms of some of the work that I have been studying. Um, and we know that transgender people, non-binary people, and intersex people experience health disparities when we compare them to right, cisgender and heterosexual people. Um, so that right there shows you, and you could look at numerous studies. We show, right, higher rates of chronic conditions. We should find higher rates of mental health challenges. We see even in many community members where we'll see higher rates of education. We don't see this equate with income like we see in other populations. Um, so a lot of that really fits into these aspects we call like social determinants of health, these pieces that we know explain why people experience health disparities. So it can be unequal opportunities in the workforce, not being able to have safe and stable housing, not being able to have other protections in terms of having to navigate healthcare and having to always explain to your provider who you are and what you need, and having to basically deal with also discrimination as you navigate the needs of your life and how those impact your health. So we see in a lot of the studies as well. I think of the example, I worked with Interact and some other groups to do one of the first studies to look at the health needs of intersex adults. And in that, I was really sort of this, it's just really showing the disparities and the challenges that we see for intersex people really stood out. And we also see an example of what we call like accelerated aging. And so this is where an intersex person actually, if we look at their, sort of physiologically, their health, they actually look like a much older person. And now, while we don't have all the information to explain why that is, I've shared all of these social determinants of health that we likely know contribute to these chronic conditions and this accelerated aging. And so that's just like one example of why we need to really understand this more clearly. But also, this requires policy change, addressing systems, you name it, so that we can allow for greater opportunities for the communities to thrive and not just have to survive in an environment that is very uninclusive.
I guess to slightly add on that, just that when you have poor access to medical treatment or medical needs at all, um, it just affects everything about you, your mental health, your social life, your ability to thrive and function in your daily life. And if you have a population of hundreds of thousands of millions of people in a given country or region that is not able to thrive because of disparities in healthcare, that's a problem. And and it is why it is relevant to outside of those healthcare settings of their that group should be more advocated for and more awareness should be spread and more support and respect for their healthcare needs. And not just because they're just random abstract people in community, but people you might know, people you've heard about, people you've interacted with, like me. Um, Putting names to faces with that and just yeah, communities are important to like support and recognize outside of one specific healthcare context.
What they said.
Yeah, I appreciate that. I think it just really speaks to the human relationships piece of it, right? It's not necessarily about all these nitty gritty details. It's like how do we just make sure that people have access to what they need to thrive like anybody else, right? Um, Something we were talking about that I'm curious if you some of you would want to address is, obviously we're talking about ways that we can whatever do better in whatever context that is for us, right? Like to improve how we're engaging in ways that can hopefully have positive impacts on health outcomes. And I think sometimes people will get maybe nervous or feel worried they're going to like do the wrong thing or not do the right thing or what have you. And I think it can be helpful to normalize the fact that we all make mistakes, right? And so I'm curious if any of you would be comfortable sharing an example of a time, kind of in your experience, where you got something wrong or took an approach that you're like in retrospect, like maybe that wasn't the way, and kind of how you responded, what you learned from it. Because I think Archie, you spoke to this a little bit earlier too, right? Like we all make mistakes. And I think sometimes how we recover from those can be meaningful more than that they happened in the first place. So yeah, curious if you can share any lessons you've learned along the way that you think would be helpful for folks to hear.
I make mistakes every day, like every single day without fail. And I'm sure I will continue making mistakes. And if I look back 5 years from now and I don't feel like I've made a bunch of mistakes, then that means that I've stopped caring and stopped trying because it turns out that none of us are perfect and we all do kind of a bad job a lot of the time. But we also do a really good job a lot of the time if we try. Um, I think that rather than like a specific example, I think that it's the most important thing about making mistakes is leaving room in the conversation for you to make mistakes and for the person to say that you made a mistake. And so, um, when interacting with somebody, like there's like bringing humility with you, bringing an understanding that you actually aren't the like you aren't the expert in this person's experience they are. And so just like coming from that place rather than walking into a room and being like, I know all that I need to know. I just need this, and this information from you. I think that that is really important. I also think that even if it is so delayed, like I think like a lot of the mistakes that I make, I don't necessarily realize in the moment, but maybe we'll be like laying in bed and then you have that dread like waft over you and you're like, oh no, what did I do? Why did I say that? What did I like? Whatever happened in that specific instance. And I think kind of going back to humility, but also like as an act of love for the other person, going to them and being like, I did, I made a mistake. I'm sorry. And not making a huge deal out of it either. Because I think that on the other side of the spectrum is that really like apologizing for you, not apologizing for the person, where you're like, I am so, so, so sorry. This is so terrible of me. Woe is me, blah, blah, blah. Like having this really, really over enthusiastic apology that then makes it this really long, awkward moment that just doesn't need to happen. Like short and quick, get to the point, ask for correction, and then move on and learn and do better. But yeah, I make mistakes every single day. And yeah, there's nothing that can be done about that.
And I also wanted to add to that something that I find very valuable and that others have said they find valuable too is saying I don't know is a completely acceptable answer to a question. If someone asks you something and you're not sure, it's much better and more honest to say, you know what, I'm not sure about that, but let me do some research, or I'm not sure, but let's look it up and find out together. So don't be afraid to say I don't know.
I can share mine. So part of my like recommendation of like, right, you've met one person, you've only met one person. And that came through my own mistakes, right? Of like generalizing or trying to, you know, uh, make assumptions about someone's lived experience or their identity. And actually, that was the motivation for the intersex study that I shared with you, that I did with Interact. And so I was at that time in my career just starting off really to do some work thinking about LGBTQ plus at the time and aging. And one of my focus areas was really to ensure representation of the transgender community. And I was living in San Francisco at the time. And by chance, I recruited intersex older adults, right? It was not on my radar. And I actually, in my like, was like, yes, I've got a transgender woman, was my assumption that I put on. And I was like, really doing all I could to recruit her to be a part of the study. And then, right, learned that actually she was an intersex woman. And it was not on my radar. It was a reminder of like you cannot make assumptions in doing research. And also I was motivated, I think, because of one, me having this lack of knowledge, but also learning about the lived experiences of the intersex older adults. I was like, why is there nothing known about the needs of intersex people as they age? Right? Most of the work at that time was only focused on youth. Um, so that was really the motivation for the study and really a commitment as I partnered with Interact and with community members to do the study. I made sure that I did not bring my own assumptions into sort of the needs or the research or even the questions that we should be asking of our community members. And so that really is something that I try to practice every day in the research that we do is that I don't make assumptions about who people are, their lived experiences, their backgrounds, their identities. And so it's something why I really push for this person-centered focus.
I was trying to think of an example that I can give. When it comes to organizing and advocacy and connecting with intersex community, I've had to sort of like remember how even in my own like journey as an intersex person, I did not always call myself intersex, and I did not always use the same terms that I use for myself now. How I've gradually gone for this a sort of kind of like medical focus lens of viewing myself to a more cultural diversity, like pro diversity sort of lens of like my body is just a variation of what's normal, and um just a very inclusive view of it. But then other people using medicalized or medical terminology for themselves does not mean that they don't view themselves in that way, and that it's not a just the me having to learn like everybody uses different language for themselves, and that makes organizing people in community not difficult, but like just sort of being aware of how everybody's experiences are different. And that's especially true with intersex people in particular because there's so many different ways people can refer to themselves as that like it can be a little overwhelming and challenging, but like it's just like like with any other community of using different words for themselves. So that's something that I've had to learn. It's just like being very knowledgeable about that universe. There is no universality for how people describe themselves as, and just going based on what that specific person might use for themselves, but making sure like I'm not making broad strokes with language that that does skew more towards like negative language. But yeah.
Yeah, I appreciate that. I feel like the common thread I'm really getting is that there's like a knowledge base and an approach, right? And it's, and even with there's a comment kind of speaking to the, just treating everyone as a unique individual. And I think both of those together are where the synergy is, right? Because I think it's helpful to know the range of experiences a person could have, right, to draw from. But yeah, at the end of the day, like every single person is going to be different, and so I think that's kind of bridging that balance. I want to make sure we take a couple minutes for questions. So. What I'm going to do, I'm going to put on back on the screen just a couple resources we highlighted for folks. We'll send out some additional, you know, more text heavy resource listing things afterward, but that also has the QR code for the evaluation. And then kind of we can do some final questions while that's up for folks that want to do that. But maybe to start with, I think the question in the comment or in the chat was really around kind of like what are the resources for learning some of these more particular skill-based pieces around working with particular populations. So if anyone wants to speak to that while I get this pulled up, that would be great.
Just to clarify, Aaron, were you referring to the comment that said, I appreciate you mentioning the different training required for differences for different identities, but how is that pursued?
Yeah, that's kind of felt like a professional development or continuing education question.
Yeah, exactly. Does anyone like want to take the lead on that? And does anyone have any ideas offhand? I just don't want to take the stage from someone else if they're ready to go.
I can share my own like approach, right? And it's not, I think this is difficult because there's not just one place to go. Each training or resources may have a unique lens from those that put together the training that may not always be fully inclusive of the needs of the community. So a lot of the work often leaves out the intersex community in the training. So there may be a focus either on just LGB, right? Or they may include transgender people, but it's not a heavy focus of the training. So a lot of times it's going to require some talking to other experts or finding out resources that are there. For instance, I like one that I go to is like Fenway, but again, it has limitations in terms of the communities that it includes and right. I look across a bunch of different resources. I have to do this is sort of that when we give the recommendation around cultural humility training, right? Is really being humble to looking at a bunch of different resources and pulling from it the pieces that are useful. but also understanding a little bit around sort of who developed those materials and what maybe guided that. So again, it's maybe one person's perspective on broader aspects and may not be truly inclusive of all like identities. I would say like even the example is a lot of the work I go to often is targeted. I do a lot of research with older adults. And so that lens really doesn't focus on youth or younger people and the evolving language and changes in care needs and other aspects. So I'm not always like I'm not the best resource for you if you wanted to know about transgender, non-binary, and intersex youth. That would not be something I would be the best person to guide you to resources. So a lot of it takes asking around, looking at other resources, and approaching it really with more questions and being open to like, oh, is this the right protocol? Who made this protocol? Where does this come from? And be like, oh, this is informative, but maybe this is not actually the gold standard, right? There may be no gold standard, especially when we think about personalized care needs. So that would be something I would recommend is to ask around, ask different people, be really open to looking at resources. The biggest piece is maybe to talk to professionals or other people in those places versus if you're a clinician, you should definitely not be asking your patients to tell you where to go. Right? That should be something you should be asking other clinicians that do the work. So make they would be the same for me. I'm not going to ask one of my research participants to tell me where I should go to learn about language. I would be going to someone else that maybe has more expertise in that area, but isn't one of my participants. So that's my opinion on it.
Another question in the chat that is, what is the best way to educate people around us on these issues? Families often are so unaccepting of these concepts.
Well, I know with intersex specific education, our website has tons of family oriented or family specific resources. I wouldn't know. Actually, I think the Trevor Project would most likely have some for LGBTQ overall and trans and non-binary specific. But just knowing what resources and organizations exist is like half the battle because then if you can find those, then like, oh, that like helps you a lot with navigating those like difficult conversations with people that are or aren't accepting or willing to like learn new things. But yeah, I think just knowing those resources exist can help a lot with navigating those things and situations.
When I am speaking with somebody who seems to not like either understand or maybe even is adamantly like opposed to what I'm like concerned about or trying to convey to them. In my experience, I find that it's most helpful when I ask them a lot of questions. And so, like, I just find that giving people the opportunity to talk and explain their own point of view makes them much more likely to listen to what you're having to say. And then also will give you an idea of what you need to say and be like, oh, that's why you think that. Oh, I get that. That makes sense. Like we all are operating under the same weird human impulses and the same, like, we're all basically the same but different in obviously many ways. And so I think like giving people the benefit of the doubt, asking them a lot of questions, and then just going from there with an open mind, is how I try to communicate with people who maybe have very different views from me or just don't know, which many people just don't know.
I wanted to add that I find like you might not be able to drastically change someone's viewpoint in a single conversation. It's more of like a process, a series of continuing conversations, an open continuing discussion. And something that can be helpful is if someone says something that sounds really inflammatory or is like a really hard stance or is really conflicting with what you're trying to share with them, ask them clarifying questions to try and get to the root of what their concern or their thought is. Because sometimes, again, when it comes to language, we all are from different generations. We use different words to mean different things. Sometimes it's the wording of a statement or question makes it sound really bad. But if you get to the root of what they're talking about, you might be able to make a little more progress or reach more of an understanding.
I appreciate that. I just want to be mindful of time so we don't keep folks past when they are free to spend time with us. Really appreciate both obviously our panelists and everyone just being here and participating and asking questions. I think we hopefully got a lot of really good takeaways. We will, of course, send out materials. And once we have the recording put together, we can share that as well. But please do continue to reach out through the coalition or whatever means, other means you might have to contact us with any other questions. Like I said, I know we want to continue having conversations like this. And so knowing what you all are most interested in learning and talking about is really helpful. And then will also help us know like what kinds of resources would be most valuable for people.
Yeah.
But yeah, again, just wanted to thank everyone for taking the time today.
Yes. I mean, don't let the sentence end here. Obviously, I'm very passionate. We have a panel full of passionate people here. I am always happy to be reached out to. I certainly don't want to let my public health advocacy efforts end here. So yeah, keep an eye, keep asking, keep thinking, be curious. That's the best thing you can do.
Is there anything you wanted to add, Gabby, before we
No, I just want to say a thank you to all of our panelists and thank you to Arcade and Aaron for doing such a great job putting this training together. I think it came together really well and we appreciate you all joining us today. So yeah, have a great rest of your day, everyone.
Our community is half the battle. This kind of education wouldn't happen without all of you.
Thank you.
thanks everyone.
Take care, everyone.